Good evening and welcome to this edition of Shanghai Live. I'm He Jian.
Good evening, I'm Chen Xuan. Top story of the night. Pediatric hospitals in Shanghai say they are seeing an increasing number of young children infected with hand, foot and mouth disease.
Health officials say the disease is often a problem in June, but this year's outbreak isn't as serious as last year's. Wenjing takes a look.
4-year-old Hao Yu has had a high fever since yesterday afternoon. The boy's mother says when she found ulcers in his mouth, she took him to the hospital.
He
has problems swallowing food. Then I saw rash on his hands and his feet has started itching. In fact, several children in my son's kindergarten have been infected with hand, foot and mouth disease.
Fudan University Children's Hospital received between 150 and 200 infected children a day on average last month, but says the number has risen to over 300 a day since the start of June. And Shanghai Children's Hospital says all of its beds are now filled with infected children. Doctors say children under the age of 5 are most vulnerable to the disease. It can be spread through direct contact with nose and throat discharges, saliva, and fluid from a patient's blisters. Most of the patients will suffer from a rash on their hands or feet, as well as a high fever. But doctors say in most cases, children don't need to be hospitalized, but should be isolated.
About 1% of the cases of hand, foot, and mouth diseases develop symptoms like brain fever and pulmonary edema. Such cases are life-threatening. If a child has a continuous high fever, vomits or sleep excessive hours during the daytime, then parents should take them to a doctor as soon as possible.
Shanghai reported nearly 4,000 cases of the disease last month. Doctors say special care should be taken during the current humid weather, and parents and schools are being told to check children's temperature and personal hygiene more frequently. Wenjing, Shanghai Live.